Hello guys, this is Jonathan Munoz, and today I want to make this episode for especially for the guys that we have been working through the weekend on how to show that you are truly aware of what's going on the American healthcare system, and how you show that when you only have words during the interview and you don't have anything else to show for this part, for this aspect. So we're going to talk about three different things. One is education, or the role of the resident as an educator mentor, the clinical documentation improvement, and lastly we're going to talk about advanced care planning and social determinants of health. These two are together because they relate together. Okay, so let's start with education. Where when I ask students to ask me questions like you were going to ask residents or a program director during the interview, education is an important part, but we have to stop looking at the basics of education, because you know that as a resident you will have to learn from older or senior residents, but at the same time you have to teach and mold the younger residents, the interns, and the medical students that will be on your charge, on your command. So what's the process? The process is simple. It's just you have to be aware of that they are going to be learning from you, and that you're going to be doing your best to teach them according to evidence-based medicine, according to best practices, with kindness, and most importantly in this topic of mentoring is the development of the skill to be able to provide feedback to the ones that you mentor, and the willingness to look for feedback from the ones that mentor you. So I hope this makes sense. As a resident, you will be evaluated. Therefore, you will receive feedback from attending physicians that you're rotating with. Usually at the end of the rotation, or at the end of the month, they will come and say, "Hey, Munoz, come here. You did this well. You did this well. You did this well, but you need to work on this, on this, on that." Now, how this is framed, how this is taught to you, the words that the person chooses to communicate this can break it, or can break you, or can make you. So you don't want to be a very critical preceptor. You don't want to be a very condescending. You want to give words of motivation, but also you want to tell the truth, because with the truth there's room for improvement for them. So let's close on this topic. If the question comes to you of how do you feel about teaching residents, teaching medical students, or you want to add this part during your tell me about yourself, you could say something like, my academic interest or my academic focus is on teaching, developing my teaching skills, being able to form newer, younger residents and medical students, developing the appropriate skill set to provide meaningful feedback that allows them to grow, and also to be able to receive meaningful feedback for my own growth. I welcome any type of feedback, and I'm working hard to develop the qualities or the skills to provide feedback that is encouraging and that comes from a place of kindness to my younger interns. Or you could say that if you're asked, for example, how do you feel about teaching? You could say, teaching has always been one of my passions. I enjoy teaching. I look forward to find mentors that I can model to, or to find interns and to find new medical students that I can teach what I already know, and we can all cooperate to grow together, to look into the same direction. So that's the basics of teaching. It's just knowing that you will teach and that you have to do it with kindness and respect to the others. Okay, so that's topic number one. Topic number two is clinical documentation improvement. And why is this important? So you will read on this weekend. We have been investigating websites for the program directors, for the attendants that are going to interview you, and we found some of them mention on their bios that one of my interests is clinical documentation improvement or clinical documentation. And what does that mean? Well, I mentioned this in previous videos, but I'm going to tell you again. Clinical documentation improvement is a little field of medicine, inpatient medicine and outpatient medicine, that not only takes care of ensuring that the doctors get paid, the hospitals get paid, nurses get paid, but beyond that, what clinical documentation improvement does is the idea of the documentation that you make in admission notes, progress notes, discharge summaries. This documentation is of such specificity that conveys the current state of your patient. You are not trying to lie to make your patient look very sick, but you are trying to give an idea of why should this patient be hospitalized? Why will this patient need a CT scan? Why are we using all these antibiotics? You're trying to pour out your mind in paper, so the final product says this patient is at this level of severity, this patient has this risk to die, and this patient needs this type of care. For example, we have a patient, 65 years old, with pneumonia, leukocyte count of 25,000, tachycardia, tachypnea. The new intern comes and says, in his note, says, this patient has pneumonia and has leukocytosis. And that's all what he says. This patient mortality is mortality risk number 1, meaning that he's not at risk of dying because he has a simple pneumonia, and his case mix index, or one of the numbers that we look at when we look at the patients, is probably below 1. It's a very low impact, low mortality, low risk patient. But the same patient, 65 years old, with leukocyte count of 25,000, with tachycardia, fever, there comes the other resident that is aware of clinical documentation improvement and says, this patient has pneumonia, he has also sepsis due to pneumonia, and respiratory failure with acute hypoxic respiratory failure due to pneumonia. So these three diagnoses now make for a mortality risk of 4, meaning that this patient is about to die. This patient can die. This patient needs probably inpatient care and IV therapy, and maybe will need life support therapy because he's so sick. And then it comes the financial aspect of this. Then it comes that patient A will get the hospital a total bill of $3,000, but patient B will get a hospital bill of $15,000. So financially, it's more beneficial to do the work on patient B than patient A. And why is this important? Why is this important for hospitals, for practices, private practices, residency programs? Because this documentation, at the end of the year, it creates a number that says, it's called the RAF score. And what it says is this practice takes care of patients that are not sick, mildly sick, severely sick. So with this comes some benefits and things that can help the practice, including bonuses, but most importantly, the fact that it is recognized that you are doing work on very sick patients. So it's very important, so important that hospitals have a special team of nurses and doctors that are called the clinical documentation practitioners, and they go around looking at notes and say, oh, this note needs improvement. Come here, Dr. Munoz. Do you think that this patient has sepsis? And I said, no, I don't. Dr. Munoz, this patient has leukocytosis, tachycardia, and fever, and we have a source. What is that called? Sepsis. Okay, so then write sepsis. Or could you amend your documentation? They're not supposed to force you, but their knowledge is such that they help you recognize things that were missing. Now, because this is such a new concept, some residents that are not open-minded say, excuse me, you're not going to tell me what to do. I'm a doctor. You're not going to tell me I have to document this. I don't believe this patient has that. So I'm going to say no. So that is what we're trying to avoid. We're trying to avoid people that don't cooperate with the team, because if an specialist on documentation is coming to you, it's because there's that deficiency. And most important, we have seen this when doctors say, no, don't talk to me. I'm a doctor. I don't need to talk to you. Bye. They're so close to even start a conversation with someone else. So we want people that understand that this is part of the current state of the healthcare system, and you will be asked very frequently to amend your documentation to try to portray the true severity of your patient, and that is very important for you to acknowledge that clinical documentation is of paramount importance. So you can also mention this on your tell me about yourself part, where you say, one of my academic focuses is clinical documentation improvement. I believe that accurate documentation and specifics of a patient's condition not only portrays the patient's severity and risk of mortality or mortality risk, but also helps me to understand his needs in terms of care, like supportive care, intravenous therapy, inpatient stay. Yeah, you could just say that. And if someone asks you, please go and read more about clinical documentation improvement. Big topic. Everyone is aware of this. If you are not, then it will be very obvious that you are not aware of what's going on this system. So now I'm telling you that this is very important, so look into that. The next topic is advanced care planning and the discussion of the end of life, and I forgot what was that part, but advanced care planning. What's advanced care planning and the social determinants of health? So basically, it comes to advanced care planning is to talk about the patient's wishes, what the patient is looking out of his care in the hospital, what is important for the patient, what really makes him or her happy, and that his wishes align to the care that we're providing. So for example, you have an 85-year-old lady that has dementia and sepsis, or just sepsis. Let's say that the lady is completely with it and has very bad sepsis UTI. So if you ask ahead of time that this, with respect and sensitivity to their beliefs and culture, you ask, ma'am, in case things go bad, would you like to, is resuscitation or supportive care one of the things that you would like for yourself? And if they say yes, that's great. Then you know that's what they wanted. But if they say no, thank God you ask, because you could have intubated or put on vasopressors a person that doesn't want that. So advanced care planning is for you to start talking to a patient about their wishes, about anticipation of things that could happen, not only during the hospitalization, but also in the outpatient setting. Because the best place to do advanced care planning is when a patient is not sick, when there are not many stressors around that could interfere with creating a sound response. So the best place is for you in the outpatient office, but it's your role. No one else can have this conversation. The MAs cannot do it, the nurses cannot do it, only the doctor, because there's a certain relationship. Now, social determinants of health, like advanced care planning, comes only, the identification of social determinants of health comes only from you talking to a patient and finding time to ask, hey, by the way, tell me more about your life. Where do you live? Do you have a home? Are you homeless? Do you have money? Do you have a job? Do you have kids? Do you have food for your family? Finding out those little things, because what if your patient doesn't have enough money to pay for food, to have 3 meals a day, but you are telling him, hey, you should have 3 meals a day because you have bad diabetes, and for the therapy that you're taking, you should eat this amount. Or you should start eating less carbohydrates, but all what he has is access to cheap food. Therefore, carbohydrates are a big part of that. So how do you know that? How do you connect this patient with the right resources if you don't know, if you haven't taken the time to talk to them about this? So advanced care planning, social determinants of health come only from talking to a patient. And how, for the last year, they have been asking, what is your understanding of what are the social determinants of health? So you should be aware what are the social determinants of health, what they do, the role. Most importantly, you should ask and you should add and say, I am passionate about the social determinants of health. I believe that a physician that takes time to get to know their patients, identify these barriers, and can be the bridge to a good health outcome by providing resources, by providing education, or by helping a hand. That's it for these 3 topics. Thank you for everyone that worked with me this weekend, and we start again next Monday with more interviews. Thank you.